32. Today we're going to use about 10 minutes to discuss one topic of the role of evidence-based practice in complementary medicine. So we're going to discuss in the following three aspects. The first one is challenges in complementary medicine. And secondly, we're going to talk about the solutions with evidence-based practice. The last part, we're going to talk about the summary. So what's the challenges of the work in the healthcare field nowadays? The biggest challenges faced by healthcare institutions today is providing evidence-based, cost-effective and quality care that will improve in practice and improve patient outcomes. Why is it such an issue? Because only 20% of what the healthcare provider do is based on evidence. What does it mean is 80% of what healthcare providers do is not based on evidence. The other very important thing need to be taken consider is that it takes about 15 to 20 years to get evidence into practice. That is simply too long, and we even face more challenges in complementary medicine. So the first one is a long history. As we all know, most of complementary medicine, we all have very long histories. But does long histories means effective? There's one story in medical history that's in 19th century and 20th century. Digitalization treatments was applied globally in heart failure patients, and the practitioner for these 200 years, the practitioner used this kind of treatment for heart failure, and this treatment is believed to reduce the mortality rates of heart failure patients. And this treatment was written in textbook to teach the young generation, the next generation for 200 years. Until late 20th century, the doctors used the scientific method to appraise the treatments. They found that digitalization treatments is not that useful because it didn't reduce the mortality rates of heart failure. So all of a sudden, for 200 years we have been using this kind of treatment, and all of a sudden we use the scientific method to appraise the results. We found that on contrary, the treatment is not that effective. Is there anything similar in our complementary medicine? How can you prove? The first one, long history, that means effective. The second challenge is case reports or case studies. In our long histories, we do have a lot of records indicating that complementary medicine is working quite well in what condition. We have a lot of case studies, but does these case studies is good enough or is meaningful to introduce as guidelines for other practitioners? So how to appraise the case reports? The third one is how to make the best decisions for your patient. And the last is how to communicate with the conventional medicine. Same as we have an example in acupuncture. We all know acupuncture is very good for stroke rehabilitation. But how to convince or how to discuss, how to tell the treatment, how do you explain the treatment with the conventional medicine? These are some of the challenges we are facing now in complementary medicine. And what's the solution? The solution is to integrate evidence in our practice to improve patient outcomes and integrate evidence in our daily practice to explain in what condition complementary works. So solutions with evidence-based practice. As you can see from the image, evidence-based practice include external evidence, patient values, and clinical expertise. These three was combined together. So what's the advantage of what's the benefits when applying evidence-based practice in complementary medicine? The first one, applying scientific statistic research method to appraise evidence from complementary medicine. During our practice, all the cases gather together and then we use the scientific statistic research method. One of the research methods is evidence-based practice. When you use them, you can appraise the evidence. Is it good enough for your patient? Is it good enough for the practice? Or is it good enough? Is it meaningful to this kind of disease? The second is evidence-based practice can lead to highest quality care and patient outcomes. Also, evidence-based practice can reduce geographic variation in delivery of care. So no matter you practice in the States, or you practice in Europe, or you practice in South Africa, doesn't really matter, because if we have the evidence-based practice, we have the result from there, we have the guidelines from there, we can introduce the treatments of the world. So no matter you practice in a city or in rural area, you can use the same guidelines for your patients. So you can gradually reduce the variations of their care, of hair care, due to the lacking of the forefront information. The last benefits from evidence-based practice is communications between conventional medicine and complementary medicine. Because we use the same research method, we use the same statistic method to appraise one treatment or the other. So the result is quite convincing for everyone. So it makes it much easier to communicate, to introduce complementary medicine to conventional medicine. So it seems that evidence-based practice is quite useful and quite good when applying in complementary medicine. Is that all? Is there any problems in evidence-based practice? Is there any problem when applying evidence-based practice in complementary medicine? The outcomes may be only suitable for certain groups of population, because the evidence-based practice, most of them, they are from systematic review or literature review, and sometimes from case study, and also there's a big group of the result is from clinical trials. When we enroll clinical trials, we set a very strict standard for certain group of patients, and the outcome from these clinical trials may not be suitable for all population. So sometimes the outcomes may not be suitable for the outcome from small sample is not suitable to introduce to the whole population. That's the first problem here. The second is standardization and individualization. These are one of the most difference between conventional medicine and complementary medicine. For evidence-based practice or conventional medicine, they all prefer standardization. But in complementary medicine, we always say everyone's different. We see patients as individuals. They got a lot of difference in their conditions, so it makes the treatment not that easier to reproductive. So we need to adjust, we need to balance the standardization and individualization when applying evidence-based practice in complementary medicine. How to make them, how to adjust, how to make them better, how to make complementary medicine standardization. There's also the problems when applying evidence-based practice in this field. The last problem here we're going to talk is the large clinical trials are costly and time-consuming. Some large clinical trials, such as the one multiple centers, the one global clinical trials, they cost a lot of money and time-consuming. Sometimes it takes years before they have any outcomes from there. It's just simply too long for the patient to wait for the results. In our daily practice, we can't wait until the outcomes before treating patients. So these are the problems in evidence-based practice. So the last thing we go to the summary. When we come back to the topic, the role of evidence-based practice. The first, evidence-based practice is paramount importance in terms of appraising clinical trials in daily practice in order to improve patient outcome to deliver high quality health care. The second is evidence-based practice is also quite important in terms of communications between conventional medicine and complementary medicine. But evidence-based practice is still developing. There are still problems need to be sorted when applying evidence-based practice in complementary medicine. Thank you for your attention. For more information, you can visit our website. See you next time.